You could have like the most flawless brushing routine in the entire world. I mean, you could brush twice a day, floss religiously, never miss a single dentist appointment, and yet you might still look in the mirror one morning and realize your teeth are looking, well, undeniably yellow.
Right, yeah.
And the craziest part about that whole scenario, it actually means your teeth are doing exactly what they are biologically supposed to do.
Yeah, which is, honestly, it's the ultimate betrayal of those hygiene rules we're all taught as kids, you know?
Oh, completely.
Because we are programmed to believe that effort equals a bright white smile. And if your smile isn't blindingly white, well, you must be doing something wrong.
Exactly, which
Right.
instantly triggers this massive wave of guilt. Like, you stand there holding your toothbrush, just wondering if you need to, I don't know, brush harder, or if you somehow missed a crucial spot for the last 3 years.
Yeah, we internalize that yellow hue as a personal failure.
We really do. But today, we are going to completely dismantle that assumption in this new deep dive. We're pulling from a really insightful clinical guide provided by the team at my gentle dentist, Arana Hills.
It's a great guide.
It really is. And they zeroed in on a question they hear from patients all the time. It actually became the overarching theme of their guide, which is this normal?
It's such a profound question, too, because it gets right to the heart of patient anxiety.
Hmm.
I mean, people are often, they're entirely too embarrassed to ask their dentist about yellowing.
Because they think they're going to get in trouble, right?
Exactly. They fear they're going to be lectured about their brushing habits.
Yeah, and the guide takes this universal frustration, the yellowing despite perfect brushing, and it just explains the underlying mechanisms of why it happens. And spoiler alert for anyone listening right now, yes, having a yellow hue is incredibly normal.
Very normal.
But the underlying reasons why brushing fails to fix it, it completely flips the script on how you should view your daily routine. Okay, let's unpack this.
Right, so to understand why a toothbrush is not like the magical whitening wand we want it to be, we have to look past the shiny surface of the tooth. We have to examine its core anatomy.
Okay.
We need to look at how a tooth is actually built, and more crucially, how that architecture ages over time.
Because a tooth isn't just a solid piece of white bone, right? It's constructed in distinct layers.
Exactly. And the two layers that dictate the color of your smile are the enamel and the dentin. So the enamel is the outermost layer.
The part we brush?
Right, the part we see and brush. It is literally the hardest substance in the human body. It acts as this like protective shield against chewing, biting, acidic foods, all of that. But it has a vulnerability.
Which is?
Over decades of daily use,
Huh.
an incredibly hard outer layer naturally thins out.
It just sort of slowly wears away from the friction of daily life.
It does, just from existing and eating. And the layer sitting directly underneath that thinning shield is the dentin. Now, dentin makes up the vast bulk of the tooth's internal structure. And here is the structural reality that shocks most people. Healthy dentin is naturally yellow.
Wait, really? It's just naturally yellow?
Naturally yellow.
Okay, let me try to visualize this. It sounds like having a frosted glass window with a yellow light bulb shining from the inside.
Oh, that's a good way to look at it.
Right, because when the window is heavily frosted, all you see on the outside is this bright, opaque white surface. But as that frost wears away over time, becoming thinner and more translucent, the yellow light from the inside just shines through much more clearly.
Yes. What's fascinating here is how that analogy captures the mechanism perfectly. The natural thinning of your frost, which is the enamel, simply reveals more of your yellow light bulb, the dentin underneath.
But wait, if the yellow color is actually coming from the inside of the tooth showing through, then scrubbing the outside of the tooth harder is a completely useless strategy.
Basically, yeah.
I mean, you are aggressively scrubbing a piece of frosted glass, hoping it changes the color of the light bulb inside. That makes no sense.
It doesn't. And that's how this anatomical reality completely shifts the blame away from the patient.
Yeah.
Like, we have been conditioned by toothpaste commercials, right, to think that yellow teeth equal bad hygiene.
Always.
But this science reframes a massive portion of tooth yellowing as a natural, inevitable process of aging. And just structural thinning. You literally cannot brush away the natural color of your internal dentin, no matter how flawless your hygiene habits are.
Wow. I genuinely hope the people listening just let out a massive sigh of relief. Like, you can officially stop feeling guilty about the natural aging of your teeth.
Absolutely.
However, we do have to acknowledge a contradiction here.
Yeah.
Because if the primary cause of yellowing is the slow thinning of enamel over decades, Why do we see, like, 25-year-olds with severely stained smiles?
Ah, right. That points us toward the secondary cause, which involves what we expose that precious enamel to on a daily basis.
Yeah.
Basically, the lifestyle factors.
Because even though enamel is the hardest substance in the body, it isn't like an impenetrable solid wall.
Far from it. On a microscopic level, enamel is actually porous.
Porous, like a sponge.
Exactly. It has these tiny microscopic channels and imperfections all over it. Now, your toothbrush is a fantastic tool for one specific job, which is removing plaque.
Right.
Plaque is that sticky structural film of bacteria that builds up on the surface. Sweeping that away is vital for preventing decay, but brushing is remarkably ineffective at lifting deep stains.
Okay, here's where it gets really interesting. Because the clinical guide lists the primary culprits for these deep stains, and it reads like a menu of literally everything that makes human existence enjoyable.
It really does.
We are talking about coffee, tea, red wine, and heavily pigmented foods like rich curries or dark berries.
Yeah, anything with an intense dark pigment is going to interact with the porosity of your enamel.
It just feels like a cruel joke of nature. You know, the morning coffee that jumpstarts your day or the evening glass of wine that helps you decompress, they're the very things attacking your smile.
Yeah, it's tough.
But let me push back on this a little bit on behalf of the obsessive brushers out there. If I spill, say, red wine on my kitchen counter and I wipe it up within 30 seconds, it doesn't stain.
Okay.
So why can't I just go to the bathroom and brush away a fresh coffee spell on my teeth before it sets?
Well, because the kitchen counter is a completely sealed, non-porous surface.
Hmm?
At least, usually it is. But your enamel is not.
Yeah.
When you drink that coffee, the dark pigments do not just sit passively on top of the tooth, waiting to be swept away.
They don't?
No, the liquid penetrates those microscopic channels in the enamel almost instantly.
Oh, wow. So they sink beneath the surface right away.
Right. And the bristles of your toothbrush are designed to sweep across the outermost flat surface of the enamel to disrupt that plaque. But they are physically too large to reach down into those microscopic pores.
Ah, I see.
So using your toothbrush is effectively like sweeping a sponge.
Yeah.
You know, it can clean the very top layer, but it cannot reach the dark liquid that has already soaked deep inside the material itself.
Sweeping a sponge. That paints a really, really frustrating picture. I mean, it means we are battling a two-front war here.
We really are.
On one side, we have the natural aging process where the enamel thins out, revealing the yellow dentin from the inside. And then on the other side, we have daily lifestyle habits driving dark pigments deep into the pores of the enamel from the outside.
Exactly.
And in both of these scenarios, a standard toothbrush is just physically incapable of solving the problem.
Yeah, those are the two major pillars of tooth discoloration. But there is actually a third pillar outlined in the guide, and it's the one variable you have absolutely zero control over.
Oh, let me guess. The genetic lottery.
You got it.
Yeah.
We can establish that age and diet play a huge role, sure. But imagine two people who are the exact same age. They drink the exact same amount of coffee every single morning. They use the exact same brushing technique. Yet one has a brilliant white smile, and the other struggles with a persistent yellow tint. This brings us right to the genetic component.
Because human biology isn't uniform.
Right.
And the guide explicitly highlights that genetics dictate the foundational baseline of your smile before you even, like, pick up a toothbrush for the first time. Some people are simply born with incredibly thick, dense enamel.
Yes. And because their enamel starts off so much thicker, it acts as a stronger biological shield. I mean, it takes decades longer for that thick layer to thin out enough to reveal the dentin underneath.
That makes sense.
Furthermore, the dentin itself isn't a universal shade.
Wait, really?
Yeah. While it is naturally yellow in everyone, the specific intensity of that yellow is genetically determined.
Oh, wow. Meaning someone could be born with naturally thinner enamel and a particularly dark yellow shade of dentin from day one.
Exactly. And that specific combination guarantees a yellower smile, regardless of how impeccably they maintain their dental hygiene.
So, what does this all mean? I feel like it means judging someone's tooth color is as absurd as judging their natural hair thickness or their skin type.
It really is.
You wouldn't look at someone with naturally fine hair and accuse them of just not shampooing correctly, you know? Some people simply hit the biological jackpot and walk around with a thick armor of blindingly white enamel, while others are just genetically predisposed to a warmer, yellower hue.
If we connect this to the bigger picture, and back to that central question of the guide, is this normal?
Yeah.
This genetic variation is the ultimate proof that a yellow hue is a highly individualized biological signature.
Yeah.
It is not a moral failing. Understanding this really should completely dissolve the shame that people carry into the dental clinic.
It is incredibly liberating information. But let's be realistic about human nature for a second.
Oh, sure.
Because even when we logically understand that the yellowing is natural, that it's age-related and genetically driven, we still desperately want to fix it.
Of course we do.
And when people realize their trusty toothbrush isn't working, they usually panic. They start looking for something much stronger. Which brings us to the final and definitely the most alarming section of this deep dive.
The pursuit of an over-the-counter miracle.
Exactly. I mean, walk down any pharmacy aisle, and you are just bombarded with these shiny holographic boxes of whitening toothpaste, right? All of them promising to transform your smile in a matter of days.
Oh, yeah.
But the guide from my gentle dentist, Arana Hills, delivers a massive reality check regarding these consumer products. Basically, they are generally only capable of removing surface-level stains.
Yeah, they hit a very hard limit. They do not possess the ability to penetrate the pores, to lift the deep-set dietary stains we talked about, and they certainly cannot alter the internal color of your dentin.
Right.
But, the inefficiency isn't actually the core issue here.
It's not.
No, the real danger lies in the mechanism they use to achieve that minor surface whitening.
Okay, because to scrub away those stubborn surface stains, these consumer pastes rely heavily on abrasive ingredients. They essentially increase the grit level.
Yes, which is a really aggressive mechanical approach to what is a very delicate biological structure.
I'm trying to think of the right way to visualize this. It sounds like using a coarse wire grill brush to clean a really delicate porcelain teacup.
Oh, that's a brilliant analogy.
Right, like, sure, if there's a coffee ring on the surface of the teacup, that wire brush might violently scratch it off, but in the process, you are permanently etching and destroying the smooth finish of the porcelain itself.
That is a terrifyingly accurate comparison.
Right.
Using highly abrasive pastes results in micro-scratching on the surface of the tooth.
Wait a minute. I need to stop and connect a dot here because this seems like a horrific paradox.
Yeah.
We established in the very first section that the fundamental cause of natural yellowing is the enamel thinning out and revealing the yellow dentin underneath, right? So if someone uses a highly abrasive, over-the-counter toothpaste every single day, aren't they just acting like sandpaper and wearing down their own enamel significantly faster?
This raises an important question, doesn't it? It is the great paradox of consumer dental care.
Wow.
By desperately trying to scrub away a natural yellow hue with harsh over-the-counter products, individuals are actively accelerating the very process that causes permanent yellowing.
That is wild. You are literally scrubbing away the white frost to reveal more of the yellow light bulb. And because enamel doesn't grow back, you are permanently making your teeth more yellow in the long run.
Exactly.
You are literally paying money at the pharmacy to accelerate the aging of your own smile.
It creates a vicious, self-defeating cycle. Patients see their teeth getting yellower, so they panic. They brush harder with even more abrasive pastes, which strips more enamel, which reveals more yellow dentin.
Okay, so if standard brushing can't reach deep stains and aggressive over-the-counter pastes act like a wire brush that just ruins your enamel, we seem to be backed into a corner here.
It feels that way, yeah.
What is the actual scientific solution? Because telling people to just embrace the yellow and stop drinking coffee, I mean, that isn't going to fly.
No, definitely not. But modern dentistry has a very elegant solution to this exact paradox. The guide points out that the safest and most effective way to brighten a smile is through professional teeth whitening treatments, like the ones administered at my gentle dentist, Arana Hills.
Okay, but how does the professional treatment bypass that wire brush effect? Like if the stain is deep in the pores, how do they get it out without destroying the surface?
Because professional treatments abandon the mechanical approach entirely.
Oh, really?
Yeah, they do not use abrasion. They rely on advanced chemistry. The professional-grade whitening agents are specifically formulated to safely navigate through those microscopic channels in the enamel.
So the chemical agent actually travels down into the sponge, to use our earlier analogy.
Exactly. It travels through the microscopic pores without altering the physical structure of the tooth at all. And once it reaches the deep-set pigmented molecules from, say, your coffee or your wine, it initiates a chemical reaction.
What does it do?
It breaks down the molecular bonds of the stain itself. It essentially shatters the dark pigments into colorless fragments.
That is fascinating. It neutralizes the stain from the inside out rather than trying to violently scratch it off from the outside in.
Spot on. And by chemically dissolving the internal pigments, the delicate enamel structure remains completely preserved.
That makes total sense.
You keep your full layer of frosted glass perfectly intact, while effectively turning down the intensity of the yellow light bulb by clearing out those accumulated dietary stains.
Which completely explains why you can't just buy this chemistry off a shelf at the grocery store. It requires a clinician to ensure the process is safely calibrated to your specific enamel thickness.
Exactly. It requires professional oversight to break that vicious cycle of enamel destruction we talked about.
Huh.
It fulfills the aesthetic desire for a brighter smile while fiercely protecting the structural integrity of your biology.
Well, this entire exploration has been incredibly eye-opening. Let's pull all of these threads together because I think we have fundamentally changed how our listeners are going to look at their bathroom mirrors tomorrow morning.
I agree. We have dismantled a lot of deeply ingrained assumptions today.
We really have. So, if you are listening to this right now and you have been quietly agonizing over the color of your teeth despite having an impeccable brushing routine, just let go of the guilt.
Truly, let it go.
What you are looking at is a complex, perfectly normal biological reality. It is the natural, inevitable thinning of your enamel revealing your yellow dentin. It is the microscopic pores of your teeth absorbing the deep pigments of the food and drink that, let's be honest, make life enjoyable. And it is the simple luck of the draw reality of your genetic baseline.
Right. And perhaps the most vital takeaway from all this is understanding the danger of that panic response. Reaching for highly abrasive, over-the-counter pastes does not solve the problem.
It makes it worse.
It does. It accelerates the destruction of your enamel and deepens the yellowing permanently. The scientifically sound path is to preserve the enamel at all costs, utilizing professional chemical treatments to lift stains safely.
Yeah, the clinical team at my gentle dentist, Arana Hills, really provided a fascinating roadmap here. It is about understanding the mechanics of your biology rather than just mindlessly fighting against it.
Absolutely.
Which actually leaves me with a lingering thought, something I want you, the listener, to mull over as you go about the rest of your day.
It is always good to step back and look at the cultural implications.
Right, because now that we understand the science, that a yellow hue is often just the sign of natural healthy dentin or simply a unique genetic signature, why is modern society so universally obsessed with blindingly white teeth?
It's a great question.
Like, where did we get the idea that an opaque, unnatural white is the only acceptable standard of beauty? Does our cultural pursuit of a purely aesthetic standard drive us toward these panic habits that actually damage the healthy biology of our own smiles?
Yeah.
Maybe the equation of effort and reward isn't broken after all. Maybe we have just been solving for the completely wrong variable this whole time.
A phenomenal question to leave them pondering.
I think so too. Well, until next time, keep asking questions and keep looking deeper.